Really, we started with a single client of a large Blues plan that needed help getting data from external sources into their system, into their data warehouse to support care management, group reporting, actuarial, whatever, anything that they needed, any of their data-driven decision making. And what they were finding is they were actually losing money because they couldn't get new groups, new employer groups that were coming on up and running fast enough to start doing the kind of medical management, care management, member outreach that they needed to do. So they turned to Jonathan and said, knew him from the previous company and said, can you help us get data onboarded faster? Jonathan was lucky enough to bring on some of his staff from HDMS who had helped build that kind of data stack at HDMS and Active Health. And they started from scratch and said, if we were going to do data integration, not just because we needed it into our own tool, but as a service that we could offer to anyone. So we're kind of agnostic to the data coming in and agnostic to the form that it comes out. And what we're really expert at is making and we focus mostly on claims data. And by claims, I mean that kind of broadly, any of the kind of administrative data, eligibility and attribution, medical and RX claims, and all the other associated data sets that go along with it. But really to make those, to create a common framework for understanding that data so that the dollars are the same regardless of what the data source is, so that you can count utilization, cost, and member information, regardless whether it comes from Humana or Cigna or Blue Cross or Aetna or CMS. That's what we do.